Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Ms. Johnson has been referred to us for an evaluation of her, quote, bite, unquote. Ms. Johnson, why were you referred to the school?
Because my bite was off and I couldn't open my mouth very well.
How wide can you open your mouth, Ms. Johnson?
Well, the doctor seems to think it's shrinking. It is tight around it.
Would you show me how wide you can open your mouth, please? Okay. Let me do that once more. And that's as wide as you can open it? Mm-hmm. Do you have any tenderness in your joints that's keeping you from opening your mouth?
No, I don't.
How long has it been this way?
Well, I started going to him in '63, and he said then my mouth was awfully small.
Mm-hmm. This is your dentist?
My dentist.
I see.
Yes.
Mm-hmm. Is this related to the lesions you have around the face?
Yes, I think so.
Do you have a diagnosis of scleroderma?
Yes, I do.
And how long have you had scleroderma?
They figure 8 to 10 years.
Mm-hmm.
I've only known it for 8 months.
And the bite problem, how long has that been present?
Well, I suppose even longer than I've been going to Dr. Gainer.
Mm-hmm.
Probably practically all my life.
I see. The thing that bothers you then is the way these teeth are overlapping your lower teeth.
Yeah.
Close, please. Just put your back teeth together. Fine. I'm testing the mobility of this tooth because I noticed when she was closing that it seemed to shift a little bit. Want to open, please? You notice this tooth is quite mobile. It is in traumatic occlusion. Compared to the next one, it's the only tooth here in the anterior part that's quite loose. Of course, the looseness may be related to periodontal pockets and loss of bone, and therefore would be secondary occlusal trauma. Now close your back teeth again, please. Open again as wide as you can. Okay. Move sideways. Back again. The other way. Close. Do you have any difficulty in speaking or swallowing?
No, I don't.
Now, in coming here to the school, what did you anticipate we might be able to do for you?
Dr. Gainer thought you might be able to put braces on my teeth to pull them back over.
Mm-hmm. In other words, a comprehensive type of orthodontic treatment to correct your occlusion.
Yes.
Mm-hmm. And since you've had this probably for some time, why is this of immediate concern?
I don't know unless it's because he found out I had that scleroderma,
Mm-hmm.
and he thought that might help. But he did want to put braces on me quite a few years ago, and I wouldn't let him.
I see. Are you familiar with the pattern insofar as the scleroderma is concerned with your mouth?
Yes, I think so.
Mm-hmm. you do have restricted opening of the mouth.
Definitely.
And in some forms of scleroderma, there are certain characteristic, more or less characteristic changes involving the mouth, limitation of opening of the mouth,
Yeah.
some difficulty later in swallowing and talking. And in some cases we find a change in the radiographs with the teeth.
Mm-hmm.
So we'll take a look at those now. In the x-rays, the patient here has an increase in the width of the periodontal membrane space. Now this is more common in the posterior teeth than it is in the anterior teeth. You notice up in the region of 8 and 9, the width is not noticeable. As we go across, as we approach 12, 13, and 14, we again notice this increase in the width of the periodontal membrane space. And there's some of this also evident in the lower films as we traverse from left to right. Now we'll look at the TMJ films, and as we look at the opening film, it's rather a normal appearing film. There's no changes which appear on the condyle, and in the closed position it is also reasonably normal. Of course, there are difficulties in making too much out of radiographic film. One of the relationships to the TM joint is that it is called false atrophy of the temporomandibular joints in scleroderma. So one of the differential diagnostic problems is to evaluate the joint with proper radiographs. Another characteristic, even though there is a wide periodontal membrane space, is that in general the teeth tend to be quite firm. Now I will test some of the posterior teeth and check to see how mobile they are. You may not be able to see this. There is some mobility present, which could well be due to the presence of periodontal disease. As you remember from the radiographs, she did have some loss of bony support in relationship to periodontitis. To close, please. Tip your open, close. I want you to keep your eye now on the central incisor. Open, close, open, close. Now do it slowly. Close, open, close. Notice how the tooth is continually being jiggled each time she opens and closes the mouth. Obviously, over a period of time, this would enhance the severity of the periodontal disease. Now we'll give her something to chew, some wax, and see if we can establish what kind of pattern of chewing she has in relationship to that particular tooth. Would you chew this, please? On the right side. You move it back further in your mouth, please. Would you chew on the other side, please?
I'm gonna really
Chew on the right side now. You notice on the right side she chews in a relatively normal fashion in the working side. And then on the left side, if you chew again on the left, please. She has a kind of a double stroke. But in both instances, whether she's chewing right or left, each time she comes into full occlusion with her posterior teeth, that central incisor is being jiggled. Now, over a period of time, one may expect with this form of scleroderma that there will be further restriction of the amount of opening of the mouth, and that there will develop probably some difficulty in the dentist doing procedures there, because of the size of the opening. And one of the concerns of the dentist, of course, here, the referring dentist, is related to the fact that he's anticipating this and really would like to know about the correction of the malocclusion. And as far as I'm concerned, certainly palliative orthodontics is in order to correct the problem with number 8, that is that upper incisor. Comprehensive orthodontics, if it's going to be done, should of course be instituted at this time. Any delay may make it difficult to get adequate treatment. Now, I don't think that her scleroderma really is a significant factor in the etiology of her malocclusion. She's had it for a great length of time. She's had the scleroderma for quite a while. So it would be impossible for us, without having seen prior cast of her and x-rays, to know just what changes have occurred in terms of the disease itself. But as far as I know, there is nothing in the literature which would indicate that malocclusion is directly related to scleroderma. Insofar as the periodontal treatment is concerned, of course, this should be taken care of as early as possible and prior to any of the palliative treatment. The immediate treatment here would be a minimal occlusal adjustment involving that number 8. However, when you are involved with this type of mobility, it's almost impossible to get an occlusal adjustment where almost as soon as you adjust it, the tooth will extrude and it will be back in its traumatic site again almost immediately. This is rather characteristic of class 4 mobility. In summary, I would say that the treatment of this case at the moment would be the minor occlusal adjustment and palliative orthodontic treatment. And if comprehensive orthodontics is anticipated, then to do it as soon as possible. It's been about a year since we've seen Mrs. Johnson, in fact, about 18 months. As you recall, we were concerned with the handling of her crossbite malocclusion in face of the overall problem, systemic problem of scleroderma. And since that time, Mrs. Johnson has had some things happen to her which somewhat changed the problem that she had. Ms. Johnson, what happened to you?
Well, I had a car accident and broke the bone here and loosened all my teeth from here back.
Your upper teeth?
My upper teeth. And They put in braces for 6 weeks, and it didn't do any good to tighten them. And then they had to extract them. And now I have dentures.
Can you open your mouth any wider now than you could before?
Possibly a little bit.
Was there any difficulty in making the denture for you because of the scleroderma?
Yes, quite a bit.
Did they use general anesthetic, or did they do this under local
Local.
anesthetic? Do you have any problems with the denture now?
No, I haven't had any particular problems.
The upper denture is the one that you had made for you.
Right.
You had no problems with the lower teeth.
No problems at all.
Let's take a look now to see what your occlusion is now at this moment. Would you open your mouth as wide as you can now, please? Move side to side, please. Still have some problems getting your mouth as wide open as you would like to, don't you? Okay, now you can rest. Bring your teeth together. Not quite so hard, please. Seems a little more pliable than last time, but still tighter than you would find normally. Close. Tap up and down. The front teeth are end-to-end bite. Posterior teeth are placed reasonably normal as far as the overjet is concerned. Now you move your jaw towards me with your teeth together, please. Back. Keep your teeth together and just move lightly, not so far. Move it out this way. Okay. Chew up and down. Okay. Base is fairly stable. Tap. Using some kind of adhesive?
Yes, I am.
Do you have any problems with chewing now?
Not a great deal, but some. I can only chew on the one side, yes.
Yeah.
Right.
You have no problems with your joints?
No.
Open, close, open, close. Move your jaw forward. Okay, back. Do you have any problems as far as medication?
I have some problems.
What kind of medication are you on?
I am on prednisone and Valium, and of course I have heart medicine now too. And that's about all.
Do you have any problem with pneumonitis or pneumonia?
Oh, I have a lot of problems with pneumonia. I've had it 5 times in the last year.
Let's see. When they did the surgical procedures on you for elimination of your teeth, did they give you a general anesthetic or a local?
Just a local.
Local anesthetic. Do you have any problems relative to that surgery? Everything go well?
Yes, things went real well.
Did they make an immediate denture for you?
Yes, they left the 4 front teeth, and then they extracted those and put my dentures right in.
So as far as your previous problem is concerned, you don't have that anymore.
No, I don't.
And you can chew pretty well, and even though it's still mostly on one side,
Right.
you can chew reasonably
But that's
well.
all I could do before.
You're right.
Yeah. I can do just about as well as I could before.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.